right, it is 12:05. I'm going to go ahead and get started. Welcome, everyone. I am Miyako Rowley. I'm a family medicine doctor and also a functional medicine doctor. For anyone who's not aware of functional medicine, it's a process where we look for the root cause and then treat that instead of only prescribing medications to kick the can down the road. And I take an integrative approach. So, in addition to a holistic approach, I also will prescribe when needed. So, we give the best of both worlds at Kale in that way. And I'm so excited to talk to you about Emsella today. It is a talk on empowering intimacy and confidence through the use of this wonderful device that we've been using in our clinic for a couple of years now. I'm going to be quick. We should be done by 12:30, so you'll have plenty of lunchtime left. And if you stick around until the end, we will have a giveaway to announce. So there will be a benefit from sticking around. Also, thank you everyone from Houston. I know that we've had quite an ordeal with power outages over the past several days since the tornado that surprised us on Thursday. So this will be recorded and rebroadcast for those who can't make it due to continued power outages. But for those who are here, welcome. Drop a note in the chat if you have any questions, and then we will have a Q&A at the end. And I think that is about it. So let's dig in. First of all, what is Emsella? Emsella is this machine that's shown here. It's a chair that you sit on, and it treats incontinence and low libido by strengthening the pelvic floor muscles. This tower system is what a staff member would be controlling, and the way that it works is there is a powerful magnet that creates a magnetic field which stimulates the muscles in your pelvic floor. That stimulation helps to decrease bladder leakage and bring more blood and interest to the area for improving sexual dysfunction. How does Emsella work? So, as I said, there is a powerful magnet that is targeted to two different areas. There are two protocols. One that directs the magnetic energy more towards the front for treating incontinence, and the other that has more of a global target area that help with libido. So the types of incontinence that Emsella can treat are both stress and urge incontinence, which are the types that women experience. Stress incontinence is where you laugh and leak a little bit or sneeze or cough. You do something that increases pressure on the pelvic floor, and the pressure from the bladder overcomes the muscles that are holding the pelvic floor tight. And so you experience that leakage. With urge incontinence, it's a situation where when you need to go to the restroom, you need to go right then, or else you might have a big explosion, not just a little leak. And that happens because the bladder muscles can spasm, and then the pressure in the bladder is overcoming the muscles in the pelvic floor that are designed to hold everything back so that you don't have that leakage. So both types are improved by Emsella because it's strengthening the pelvic floor muscles. So then you don't have that disability to control the pressure in the bladder. And of course, by strengthening the tone of those muscles, that increases libido as well as bringing blood to the area. And I've spoken a lot about pelvic floor muscles. I think this is a great diagram here at the bottom that shows the whole pelvis. So if you put your hands on your hips and you kind of push down until you reach bone, those are these bones that we're seeing. So we've got two very large bones that come together like a basket. Now imagine that you take a balloon and you fill it up and you sit it down into the pelvis. Wherever that balloon is touching bone, that's where the pelvic floor exists. So it's not just down at the bottom where we see muscles on the outside. It goes all the way up to the top of this pelvic girdle. And so those muscles provide support for the organs that are in there, the bladder, the uterus. In the case for men, it's the prostate. And so the case for treating incontinence for men is, or urinary issues, I should say, for men, is as the prostate enlarges, it can obstruct the urine flow, the opening of the urethra on the pelvic side. And so the muscles that are stronger can overcome that physical obstruction and help to increase the stream of urinary flow for men. So it helps a lot of different situations. Specifically, who Emsella can benefit are people who are experiencing incontinence and sexual dysfunction, or both. Some situations where this may arise are after giving birth. Imagine you've had this 5 to 9 pound baby, usually sitting on the muscles of the pelvic floor in the uterus as that has gotten very heavy. That puts a lot of strain and pressure on those muscles. And so those muscles become lax. And so stress incontinence, or the sneezing and coughing and a little bit of leakage type of incontinence, increases. It's pretty common. This can also happen because of vaginal deliveries. So those muscles become very lax from the passage of the baby through the birth canal, and can also affect the urinary muscles at that time as well. So Emsella can help in situations after childbirth. Also, in menopausal women, the muscles of the pelvic floor start to get looser. They start to lose tone, especially because estrogen has decreased. So a lot of our patients at Kale have hormone replacement therapy with estriol, which is a suppository of estrogen, and that does help strengthen the vaginal tissues, but it's not helping the urinary tissues. So even when we have that strengthening of the tissues, we're not getting the benefits of treating urinary problems. In addition, we're really only treating the vaginal tissues when we're using estriol, but you can imagine that there's a complex system of muscles in the whole pelvic floor when you think of that whole pelvic girdle. And so Emsella goes a step further. So it provides further benefit, which can help, again, either low libido or urinary issues. Another situation where urinary or libido issues may arise are after surgery or radiation that may affect the pelvic floor muscles. So both for women and men, this can be a great benefit. So there's a wide variety of situations where Emsella can be very helpful. Who shouldn't use Emsella? There are certainly 3 main contraindications or reasons that Emsella should not be used. During pregnancy, Emsella is a no-go. After pregnancy, it's wonderful, but during pregnancy, we want to leave the uterus undisturbed. So should not be used during pregnancy. Metal implant. This representation is a copper IUD or Paragard IUD. Because it has metal in it, we wouldn't want to cause it to get displaced by the magnets in the machine. So we would discourage use of Emsella in that situation. Other implants that are metal might be clips after a breast surgery that are put in place to mark where something was resected, or mark an area that was of surgical interest that a surgeon may want to go back and see later. We wouldn't want those to get displaced. Metal rods for bone breaks that are surgically repaired would be a contraindication. Metal dental implants. There is a caveat to metal implants. If you've had them well established for a long time, it's probably very unlikely that they will get dislodged. Typically, when you are on the machine and there are, like jewelry or other metal objects that are in reasonable proximity, they're not just going to fly across the room onto the machine. But because we want to be super careful, we have to really think through whether or not we would want to use Emsella in those situations. Finally, anyone with a pacemaker should not use Emsella. It could cause misfiring of the pacemaker, and so we would just want to stay clear of that situation. The benefits of Emsella are that it's non-invasive. There's no surgery. There's no downtime. You don't have to plan around recovery. You literally go into the center, sit on the chair, have a session for 30 minutes. Ideally, the sessions are spaced 3 days apart, so that gives enough time for the muscles to start to develop and re-strengthen but then not so far apart that you're not taking advantage of the momentum that you've built from the previous treatment. So ideally, 3 days apart, 6 sessions is a complete treatment. So you may start to see results before you get to all 6 sessions, but studies show that it takes a full 6 sessions to get the full benefit. Again, you can go to whatever activities that you desire afterwards, whether that's traveling, going back to work, playing pickleball, whatever you want to do. There is no activity that is not safe to do after Emsella. There are proven results. The company has published saying that 95% of patients who use Emsella experience relief from incontinence and increased libido. 75% report reduced usage of pads for leak. And there are also several randomized controlled trials and meta-analyses, which are a collection of randomized controlled trials. Randomized controlled trials are the gold standard, and I would say the platinum standard is meta-analyses. So there are plenty of studies that if you Google, you'll find them that show that there is a benefit to this type of magnetic stimulation to treat incontinence. And then, of course, it's a relationship booster. When libido is increased, wellness and overall quality of life is improved. So it can be a relationship rescue, it can be a relationship enhancer. Either way, these benefits come with the use of Emsella. I put together a video here to show what to expect from Emsella treatment at Kale. So I'll just go ahead and play this.
At Kale Functional Medicine, Emsella takes place tucked away in a private and comfortable location in our clinic. You will be greeted by a friendly staff member who will instruct you to remove electronics such as smartwatches and mobile phones, which can be damaged by the chair's magnet. No disrobing is needed. You may wear whatever clothes you prefer. Next, you will be instructed on how to properly position to treat the targeted area. Then, test pulses will be administered to further ensure proper positioning on the chair. Once properly positioned, you give permission to increase the intensity of pulses from 1 to 10. Optimal results are achieved when the machine is at level 10, however, the intensity will not be increased without your permission. Complete treatment is 6 sessions of 30 minutes, ideally 3 days apart. After your session, you can expect to resume normal activities immediately.
All right. So in conclusion, actually, we have some testimonials from real patients, people who have actually tried Emsella and really benefited from it. These are obviously not the patients, but these are real patient words. So from our clinic. So one patient says, I can finally jump on the trampoline again. That is just freedom, being able to do the normal activities that you want to do without being worried about leakage or having to run to the restroom. It's nice to be able to travel and not have to map out where the bathrooms are because you're worried about needing to go immediately when it's time to go. It's nice to just be carefree again and have that control back. So in that way, Emsella restores confidence. Another patient says it's very effective and does exactly what it promises. So again, increasing interest in the area, bringing blood flow to the area, tightening the muscles in the area can all help with improving and relationships, improving libido, improving quality of life. All right. So finally, in conclusion, it is safe and effective. It's not painful. That might be a question, but when you sit on the machine, the stimulation that you're getting feels somewhat like a TENS unit, but a TENS unit only reaches the superficial layers, just kind of the outside layers of the muscles. Whereas with the stronger magnets, you get penetration through all of the pelvic floor. So you're really getting a deeper level of treatment than you could with something surface like a TENS unit. But that's a good estimation of what to expect for what it feels like. You feel a vibration, but not painful. It treats incontinence and sexual dysfunction. It's not invasive. There's no surgery, no medicine. So for our patients or for women in general who have struggled with incontinence, men who struggle with low urinary flow, and people who say, I don't want medication, I don't want surgery, so I'll just deal with it. This is another option. So you don't have to just suffer through it. We can, and suffer in silence, many of us do. You can get treatment for it. It's quick, it's easy, no downtime, no disrobing. So you can just sit on the chair, whatever clothes you please. I will say that if possible, It's better to wear a skirt or a dress or thin pants like leggings to get the full benefit. But even if you have on thick jeans, you can still use the machine. And then, of course, go back to your normal activities afterward.